Hi, welcome to Lessons from the Lab. Today we're going to be talking about care mapping, and we're going to focus specifically on priority care mapping. Go ahead, let out your groans. We know no one likes care mapping, but it does serve an important piece of understanding and developing ways to make connections and think through processes. Remember that lovely nursing process? It's really important for us to get that skill down and honed in well. And priority is something that nurses are always concerned about. So what we're going to do today is I drew on here a circle in the middle and then 4 rectangles around. What I do is I put my disease process or what's going on with the patient in the middle. So we're going to do short gut, and it's okay if you don't know what this is, but you could pause the video right now and take a few minutes to look it up so you understand a little bit more what I'm talking about as the example. We're going to talk about short gut. Now, what I do from there is I put 1, 2, 3, and 4. So those are my priorities, and that is the order that I am worried about them in. So if you've looked up stuff on short gut, you've probably thought about the biggest priority is fluid and electrolyte or potentially nutrition, depending on how you rationalized it, okay? Then our next thing is elimination. Right? And then depending on what you read about it or what you researched, you might have coping. And then depending on something that you might be a variable of how they got it, you might be thinking about pain, cell reg, any of those kinds of things might be kind of how you're thinking about it. So we've got our first thing, we've kind of gone through our priorities. Now we have to defend why we picked that priority. And the easiest way to defend how and why you picked a priority is by understanding the pathophysiology. This is where nursing and science comes together. Nurses are not just people that take care of people and take people to the bathroom and, say encouraging thing and hold hands. We have to understand the science of what's going on. So for fluid and electrolytes, why I would pick this is because I know that this is going to be a malabsorption problem, that they're not going to absorb the electrolytes they need. I also know they're going to have a lot of fluid loss as they go to the bathroom constantly, because short gut means that that intestine has been shortened and they're not having enough space or time to absorb. All right, so they're going to have those kinds of problems. That's the pathophysiology of what's going on. That's understanding the disease process. When I go to elimination, short gut, because people go to the bathroom a lot when they have this, right? As soon as they eat, it stimulates that exit. So they're going to have frequent stooling. All right, they may have an ostomy of some sort, which then causes elimination issues all on its own. Understanding this, if I understand frequent stooling and ostomy, then that might also spin me off into another concept of tissue intake, because I'm worried about that around those kinds of issues. The coping, because I go back again to that physiology, that malabsorption, the going to the bathroom all the time has a great impact on their life, on their daily living. And that's going to cause some issues. Not to mention with that malabsorption, they're probably going to be pretty skinny because they're never going to gain weight. All right. And then pain over here, why I would pick pain? Well, maybe I read about this patient, or I read about someone that has this, and they have cramping because of all of this. Or they have pain from surgery, or they have pain from strictures, or pain that caused them to get this in the first place. So it's applying it to your patient as well as the information that you might read and understand about the disease. So what's really cool about this, though, is if you know the pathophysiology, your nursing interventions come right off of that, right? So if we have malabsorption and loss, what are we going to do for this person? Well, we're probably going to do daily weights, right? Because we want to know. We're probably going to do some labs and get specifically into like our CMP. We want to look at those electrolytes. We want to see how much fluid they're losing. We might have to encourage fluid, or we might have to start IVs because they need some sort of access to get fluid back in them to get them hydrated. Down here we've got stooling, so we're going to make sure that we're doing a bathroom routine, right? We might need to do peri-cares and take care of that. For that, it's also to take care of this and the tissue integrity issues. So that might be something. Over here, we've got increased impact of daily living. So maybe we want to encourage independence. Okay? Maybe we want to use therapeutic communication, which we should always want to use, but maybe that's something we're really going to focus on. Over here, pain cramping and from this cramping. Well, we're going to give some meds maybe to help with some of that cramping and help with some of that pain. But if you understand the concepts and the pathophysiology, you can treat any patient. That's the beauty of using concepts, is that we can't teach you every disease. I can't teach you every disease or every medication that's out there, but I can teach you every concept that you will need to take care of every patient. So this is what I call priority care mapping. It's helping you hone down and figure out what's really important about this patient and what's really important about their care. So what I want you to do is practice this, try it with your patients, try it with activities that you're doing in school to help you figure out where's really my priority for my patient. Because maybe after I've gotten report, fluid and electrolytes not my priority, maybe it's that they're in severe pain and I need to address that issue first. So it's also going to change depending on your patient data that you bring in and that you get from your assessment and from report and all that kind of stuff as well. Maybe their medications, anywhere we can collect data. So just understand, priority care mapping, pick your top 4, explain why you picked it, and then the nursing interventions, just roll off of it. If you have any questions, let me know. Otherwise, have a great time learning and using a different tool and technique.